Hey guys, my name is Ash. I am a birth coach and personal trainer, and today we're going to be talking about perineal dilators. So, what is a perineal dilator exactly? So, a perineal dilator is a medical device that is used inside the birth canal to help enhance natural birthing and reduce pelvic floor damage and perineal tearing. As a birth coach and a personal trainer, I feel it's really important that women know more about using perineal dilators, or what I like to call my design, a birth balloon. Reason being is when we don't have an effective technique and the knowledge on how to birth effectively, we can cause lifelong trauma to our body. So this includes incontinence, urinary incontinence. That's where you may cough or sneeze and you don't have control over your bladder, so you will be out and you can wet yourself. It also includes fecal incontinence, so it's exactly the same. Coughing, sneezing, or just unaware that you are, pooing yourself. And then there's organ prolapse. So this is where the internal organs such as the bladder, the uterus, or even the bowel can drop down or even come outside the body. So correcting these types of problems may include surgery. You might have to have some sort of suturing to repair the muscles so that they are able to hold together. Or you may need to go and see a pelvic floor physiotherapist who will see you for a number of sessions to do an assessment and then exercises which you would need to then carry out potentially daily, weekly, or monthly over the length of a period of time, or maybe for the rest of your life. The effects of pelvic floor damage and perineal trauma is it's a long recovery. So after having a baby, your priority and your focus wants to be on, enjoying the time with your baby, bonding with your baby, and that's really difficult, especially if you are having these complications where you're unable to go to the bathroom and it's really quite painful, or you then need to go in for secondary surgery or some sort of recovery with a physiotherapist to be able to help you manage these symptoms that you might be having. As a birth coach and PT, I truly believe that prevention is better than cure. So if we can understand the process of birth and prepare ourselves to be fit and strong and manage our birth, we are able to prevent these types or reduce these types of things that may happen to us. So this is our pelvic floor, and basically we can see the bladder, we can see the uterus, and this is the colon here, or the rectum. And basically when the muscle that is spanning between all three of these is damaged, which holds our organs up, this is what causes them to drop and fall down below. So we want to exercise these muscles to allow the baby to descend gently and calmly and controlled out of our birth canal so that we can avoid damage to our muscle band that's there, and we can also avoid damaging the opening between our birth canal and our rectum so that there is no tear there. So a perineal dilator is made of soft medical silicone, and it comes with an inflatable balloon and a hand pump bulb with an air release valve to let the air out of the balloon. It's also joined by a tube or hose. So how does it work? The balloon is inserted into the birth canal, and the hand pump bulb is used to blow the balloon up to a size that is comfortable to tolerate. What then happens is you then practice engaging your pelvic floor muscles to birth the balloon out comfortably and safely. This also allows you to feel what it would feel like through crowning or active birthing of your baby, as your perineum, or the birth opening, is stretched. Sometimes when we are having contractions, it's very common for a woman to feel like she feels like she needs to push. And during that process, we can bear down and push really, really hard, and the baby can be pushed out rapidly. And this is what causes tearing. So by using this balloon, we're able to safely simulate the circumference of a baby's head and get the feeling of what it feels like for our baby to descend down, and then practice birthing the baby out without causing any sort of tearing. Ultimately, the goal is to get somewhat close to the circumference of a baby's head. That way you can simulate or replicate actual, natural birthing. And ideally, you don't want to have any pain relief when you're doing this process in labor, because you actually want to feel what birth feels like so that you know how to actually do correct birthing. So it defeats the purpose by having an epidural. If you're numb from the waist down, you can't actually feel if the baby's coming out or descending. And if you push or the baby is being sort of pulled from you when you're having a contraction, it will obviously damage your pelvic floor muscles, the banda muscles I showed you before, and your perineum, which is the skin and the connective tissues between the birth canal and the rectum. So during training, you will do this from 37 weeks up until you go into labor. Anything prior to that is considered quite dangerous because you don't want your baby to be born prior to that. This device won't put you into labor early. And this particular model that I made myself, it has a thick tip at the end. So when it does go to rest on the cervix, as the balloon expands, it's not actually disrupting the cervix itself, which means that the cervix won't open. So the cervix is like a little donut that sits at the top of your birth canal, and that separates the baby from coming out to being birthed. So you don't want to disrupt that, and that's why, this is a safe process. Now, because this is a silicone device, I had handles made on mine because sometimes the balloon can feel like it's moving automatically because your muscles can be engaged. And when that happens, you want to be able to have something that you can sort of hold on to while you're holding the pump, and feel quite comfortable while you're doing it. So this particular device that I had made, I had it modified and changed over a number of years because I have had 3 natural births, and with each one I used this device, modified it, changed it, improved it, and continued with that whole concept. And I just had my last baby 13 weeks ago. But basically, I've not had any tears, any trauma, or any sutures or anything like that. And my pelvic floor is really, really strong. So I guess one question people might ask, am I going to become like loose from this? It's kind of like being, like, as a personal trainer telling you this, it's like being a gymnast. A gymnast is super strong and super flexible. It's the exact same thing. So by doing this exercise, you are training your pelvic floor to be super strong, but also really, really flexible too. And then because you understand how to have the correct form and technique in labor, you're also really relaxed. So it doesn't feel overwhelming. You can ride the waves of contractions and you understand how they're working to help you birth your baby rather than fight against them and resist them. Because one of the things that can happen is when we're in labor, we become quite tense and we can tense our pelvic floor. And when we do that, that actually prevents our baby from descending out. So our baby comes down, wants to come out, and we have a tense pelvic floor that holds the bladder, and the other organs up, and that doesn't allow our baby to come down. And when that happens, we then need some sort of intervention to be able to help bring and pull our baby out, along with the contractions that are pushing down at the same time too. Currently at the moment, there is only 2 other products out on the market globally. That is this device here, which is the Epino. Their branding is blue. It's a German design. And also the Anabol, which is this pink design. And I think they're from the Czech Republic. I'm not 100% sure, but it's European. Unfortunately, with FDA, both of these devices are unable to be sold in America and as well in Canada as well, because I believe that Canada Medical doesn't, they didn't pay the rights to have their product there. So unfortunately you can't get this particular device. But we're saying that here in Australia, I didn't actually use either of these for my births. I went and had my product made because I found that I needed something completely different. You can't purchase this because I don't have the funding to be able to have this device made, but I just wanted to share my birth story. So if you can get your hands on one of these, it will be really, truly beneficial. So yes, again, this is the Anabol and this is the Epino.